I'd like to call this meeting of Health and Human Services to order on June 17th at 1:03 p.m. Clerk, can you please call the roll?
Legislator Kelly.
Here.
Denton. Here. Block. Here. Burtis. Absent. Chairman Romeo.
Here. Legislator Burtis did let me know he had something, so he wasn't able to make it. First order of business is to approve the minutes of the previous meeting. Are there any objections to the previous meeting? Minutes? Seeing none, the minutes are approved. All right. We're going to change the schedule a little bit. Chairwoman Watts asked to go first, and we are doing that for her. Chairwoman Watts.
Appreciate it. Beautiful. All right, so I'm just here to do the little budget update, which I think everybody has been through a meeting so far doing it. So just as a reminder on how we're going to do the budget this year, the county executives branch is working right now on their pro forma and departmental budgets. It is going to be coming to us via the county executives announcement first, which is in the charter for him to give a presentation on the 15th to the legislature. That then is followed by the presentations. We are going to be doing the presentation portion a bit differently this year. Historically, they were given exclusively to the Ways and Means Committee, though everyone was able to attend. We're going to officially make them joint committee meetings, and they will be scheduled essentially half days for each program committee. So in this case, Health and Human Services will have a joint committee meeting with Ways and Means for the presentations of all the budgets for the departments that fall under the Health and Human Services Committee purview. Those presentations are going to be wholly focused on the budget itself, which is part of why these informationals have been taking place. The goal is that the informationals will all be wrapped up prior to budget season. And so if we have program questions that we haven't gotten to get answered, kind of larger scale, especially prepping for budget, encourage you to try to get those answered before the budget, because then we can fully focus on those numbers in the budget itself. In order to prepare for that, we're looking to have every legislator have 1 to 3 different departments based on your committees that you're just kind of taking a lead on. I've spoken quite a bit with Legislator Block about adult and long-term care. We've got some different nonprofits that are coming to us with requests to be included in the budget. And so those that are working with seniors, we're going to direct those, at least loop in Legislator Block. If not, if it's your district, you still are championing it. But if it's, more of a general county request, kind of trying to connect those corresponding requests with the person with that department so that we can really kind of look at the bigger picture and see okay, we've got four different agencies that are looking to do these things related to adult and long-term care. How are we going to make these determinations of what, where, when, and then how that might be included in next year's budget. So there's 3 things that we're each looking at in those things is where do we see, where are we getting requests to add from fellow legislators or from our constituents? What are cuts potentially that might be needing to be considered? And what are lines that might want to be put into contingency? It's okay if the answer is nothing for the departments that you're working on, but just kind of having that mindfulness as you look through this year's budget and get a sense of this year's budget. And then when next year's comes out, hopefully it'll feel very familiar and be more readily able to ask questions. Following the joint committee meeting, we're going to have just regular committee meetings in September. They'll just be different weeks and different days. So that schedule will be out by the end of the week to everyone so we can plan accordingly. During that regular committee meeting, it'll be just like usual. Any business that gets sent over to Health and Human Services, if there is any resolution-wise, etc., will get addressed in that meeting. And then there will be the agenda item of discussing the budgets for the Health and Human Services. And then as committee chair, Legislator Romeo will present on behalf of the Health and Human Services Program Committee to Ways and Means regarding any additions, cuts, or contingencies that are being proposed by this committee. And then it gets taken up by the Ways and Means to head towards the Ways and Means report being submitted back to the county executive's office. And then we go back into the process as is more typical and usual. So the schedule will be coming your way, and as well as reminders on departmental matches based on committees. If you have any questions or concerns, please get right back with them. Feel free to voice them now. Want to make sure we get this locked in if we can by the end of the month, just so we're all on the same page with what that all looks like. Any questions, concerns, thoughts at this point?
What's the argument to do it this way rather than channeling things through, say, committee chairs or floor leaders?
So through committee, we are kind of doing it through committee chairs now, right? Like that's essentially part of the flow is committees work with their committee chair to represent the departments under the committee's purview. So that is actually what this is kind of doing. Ways and Means historically did it more solo. So I know everyone was around for presentations and participated as a whole legislator. It's essentially the argument of doing it this way is really to involve more of us who are hopefully closer into these departments. Like each of us, because of the informationals, because of the work, your committee has put you in closer proximity to these departments. So we're going to be more able to ask meaningful questions and engage with it at a higher level than if someone maybe who hasn't been able to hear all the information about fill in the blank with whatever department it is.
Yeah, I just think of, I think you used did anybody use the term point person at any point? Or is that just in my?
Yes. So
That's what I think of those people as being, is the point people on a lot of these issues, but
yes.
thank you.
Yes. Yep. Yeah. Kind of the higher level of just involvement of all of us. I think more hands make lighter work and more eyes make better accountability, right?
Great.
Great.
Thank you,
Thank
Chairwoman.
you.
For the next item on the agenda, we have the Department of Children and Family Services that has joined us, and we'll be doing a presentation, excuse me, about children's mental health and school-based initiatives. Hello. If you can state your name and position into the microphone, please. Oh, can you push the button, turn screen? Yeah.
Good afternoon, Amy Cunningham, Commissioner of the Department of Children and Family Services.
Hi, Jen. Jennifer Parmalee, Deputy Commissioner for the Department of Children and Family Services.
Thank you for joining us.
Thank
When you're ready.
you. So we've been here a few times now, and just to kind of reiterate what the department, how we're structured, we have 5 different divisions within the Department of Children and Family Services. We heard about child welfare back in January. We heard about adult mental health as well. Today we're here to talk about children's mental health and school-based initiatives, and we also have juvenile justice and our youth development programming within our department too. So I'm going to turn it over to Jen to talk about our children's mental health.
Thank you. So I do have a handout for everyone, if you wouldn't mind taking one and passing it down. Thank you. So to start off with, I want to share that Onondaga County has a tremendous reputation within New York State for being on the forefront, on the cutting edge of children's mental health. We're known for being highly collaborative and supportive of each other within our systems. The concept of the work is to ensure that we are partnering and collaborating with all of the different partners to ensure that kids and families get access to the supports that they need when they need them. This work and this reputation has been earned through painstaking work over many years. And we're doing as much as we can at an evidence-based level. So we're really excited about the work that we're doing. So when you look at the first page, just a reminder, we talked a little bit about this when we were reviewing the adult mental health world. The county receives dollars that are administered through 3 different agencies within New York State: the Office of Mental Health, the Office of Addiction Services and Supports, and also OPWDD, which is the Office of People with Developmental Challenges. The work that we do is very much geared towards supporting, as I said, individuals across all different needs within our system. So we work at a preventive level, we work at an intervention level, and we work at a high needs level. We do this, the way that we do this is through the system of care. The system of care is an evidence-based framework that is being implemented across the nation. It's highly effective in helping to identify youth that may be struggling, getting them into services that they need, and doing so in a way that does not that kind of moves us away from silos. So if you come into the system from a school setting, if you come into the system from a mental health setting, from a juvenile justice setting, from a child welfare setting, the goal is to ensure that we are identifying needs and getting access to care in a coordinated manner. So if you take a look at the next page, it kind of walks us through a little bit about the system of care approach. Again, this concept of knowing what all the different players can do, how they do that, working at a county and a state level to blend funding and maximize funding for services so that we can ensure that, hi, oh yes, thank you. I have extras up here if anyone else in the room would like some, so that we are, again, supporting needs at the time that they arise, and doing so under a set of values. And that those values are family driven, so recognizing that families are the experts in what their children need. They're the experts in what interventions would work best for their family and would work best for their youth. Youth guided is the second principle or value, and that recognizes that if youth have a say in their plan, if youth are able to express what's most important to them, then whatever plan is put together is going to be something that youth is going to be heavily engaged in and want to work towards. Community focus, so recognizing that kids and families do better when kids are in their community rather than in a residential placement outside of the community. And in order sometimes to allow for that to happen, we need to be highly creative and highly collaborative within different settings and within our different service sectors. Making sure that evidence-based practices are a significant component of what we're offering across all the different agencies and levels of service. Ensuring that we're culturally responsive, so recognizing that every family has a set of values and has a set of beliefs that we honor, and we recognize that their plans need to respect and honor those. And then finally being data-driven, ensuring that we are making decisions not only at a case level, but also at a systems level based on the data that we're collecting to help us understand where the challenges are. So, this work is made possible through tremendous collaboration that the county has been working painstakingly for years to develop with schools, with child welfare, juvenile justice, our hospitals, all the different systems, all the different child serving systems coming together on a regular basis to talk about how the system's functioning, what's working, what's not working, what we can be doing.
Can
Yeah.
I ask a question about that? You talked about the data-driven piece. What kind of data do you use in that to look at that system-wide needs and things like that?
So we have a couple of different structures that we do. We have our state data that's provided. We have, different dashboards that OMH provides, OASAS provides, and OPWD provide, and that's very helpful to help us understand who's being served, like within the Medicaid population. We have access to a system called Psyches, which allows for us to look at in depth how those who are being served in the Medicaid population are receiving services, where they're getting services, that kind of thing. At a contract level, we also implement the results-based accountability structure, which it's been very successful in our department. So this functions as an opportunity for our contractors to say not only what's working, how much they're doing, but who's actually better off because of the work that they're doing. So we're finding that to be very helpful. And then we'll be reviewing this data. We review this data oftentimes like with our stakeholders. That our children's system of care has a stakeholder group that meets once a month that involves individuals who are receiving services, their families, providers, schools. And so we'll take specific data pieces, we'll look at those together as a team, we'll talk about that, we'll explore that together.
Great, thank you. So I love the idea of the results-based piece of it too. What about people that might need the service and aren't getting it? How do we track that?
So this is an excellent question. We've done so much work over, I'd say, the last 5 to 6 years to ensure that we are maximizing identification points. So one of the things that we've done to address this concern, because we share in the concern, is to establish our access team. This is our No Wrong Door team that has 37 members at this time. And they partner in many different locations to help identify kids who may be struggling. So one of the main components of the work of Access is to partner with the schools. And so every school in Onondaga County has a contact person within Access. We meet with schools regularly to talk about who they may have concerns about. As we all know, schools have, dedicated, trained professionals who care deeply about these youth and often are the first to be able to identify if there's a challenge that might be happening. And so that school piece is a huge identification point. We also push out to, communication to families. Families can self-refer. We work with hospitals. We're meeting regularly with hospitals to identify kids who may be in the emergency room or may be inpatient. And we also meet regularly with the mobile crisis teams. So monthly, we're going through, what calls came in, are we aware of these youth, that kind of thing. We spend a lot of time engaging with schools and community, tabling as much as we can to help put out that, hey, this team can support you. The team is highly trained in relentless pursuit of engagement. That's our structure. And they work when they work with families where they're identifying that their needs are, right? So if they're referred from the school and the school is saying, hey, we really want you to focus on attendance, we will accept that referral. And when we're going out and meeting with the family, we'll do a global assessment. And if the family wants to start in a different place than attendance, we recognize that moving in that direction with that family oftentimes then has the positive benefit of addressing attendance. And so we work really hard to meet families' needs the way that they're defining.
Thank you. And
welcome.
with that, what do we know about what we're able to provide and what that need is? So as
Where's
as
the
you're
gap?
finding and collecting all this data, are we just
Mhm.
able to get everybody that needs it? And is there like a delay? What about services available?
So
Does that make sense?
It's such a great question, and it's why we're constantly working on the system, because it shifts and changes, every 6 months, let's say. So like when we're feeling really good, like we've got our system moving and shaking, we'll have a workforce shortage. And so what we work to try to do is ensure that we're on top of those needs that are changing and then working collaboratively across the system to address them. And that's where the system of care has been the most effective and impactful, because things change constantly. And as a system, we need to not move at a snail's pace. We need to move immediately to address those needs. So, if you ask me today what some of the gaps are, my answer is going to be very different than what the gaps were 6 months ago. We are, still experiencing a workforce shortage. We are working with different providers who, for instance, in the last 3 months have struggled with hiring prescribers. So these are psychiatrists and nurse practitioners that can prescribe medication. And so we've been working with them and with the state to help figure out how we kind of move those hirings, in a more effective and efficient way. And sometimes there's system barriers to that. Sometimes there's, relationship barriers to that. Like we just need to connect them with, let's say, upstate fellows, that kind of stuff. So we kind of work as a county at the center of providing those connections and those supports.
Thank you.
Mhm.
Sorry to interrupt you.
No, that's okay.
If I could, I don't know that there's any role in healthcare without or with an abundance of providers at this point. So I think that's a well-documented challenge.
Yes.
I did want to ask, has the new academic health partnership presented any opportunities for your department with the work that you're doing, either with regards to youth mental health or anything else where you've been able to capitalize on, say, best practice or anything like that?
Can you be more specific?
So, is there ongoing research that says the best practice of, children's mental health in the school setting is this provider at this frequency in this setting, just
I see.
anything like that.
I'm sorry, I'm referring to the academic partnership. I'm sorry, do you mean like
Oh,
with
the,
Upstate?
yes, with Upstate.
Thank you. Well, we're learning a lot through that partnership. We're so excited about the work that's happening. We're learning a lot, and we don't have a study at this point in time that's pointing to specific kind of proof of concept, but the experience I think that most of us are having is showing us that kids are moving quicker through the system, that kids are getting access to help in a way that they weren't able to before, and that what's been really exciting about like what Upstate's been able to do is make sure that there are psychological services alongside social work services and psychiatric services. And so there's a multidisciplinary team that is honestly, from a mental health perspective, very expensive to provide. And so the fact that they've been able, because they have those resources and they have access to those professionals, to provide that support, provide that in, like in classroom and classroom observations, I think we found to be really helpful. I think the way we like to think of the world, and I'll talk more about this when we talk about school-based, is through that public health triangle. So, what we do for 80% of kids and how we know if they're struggling or not, what we do for 20% of kids, and then that 15%, and then that top 5%. What we're finding is that our traditional school-based model, which we're known for across the state, and we're known for being just on the cutting edge with this and tremendous implementation. We're finding that second level of tier, our traditional approach has been highly effective in that realm. Where this new Upstate partnership is showing us that they're the most effective is those youth that have the highest level of need. And so they fit really beautifully in the system, and they're serving a little bit of a different population. Both are essential to making sure that kids and families are seen quickly, seen with a multidisciplinary team. Like, our traditional school-based model has teachers and school psychologists and nurses able to be on the team to support the youth as well as the family. So that's some of the things that we're learning right now.
Is there a rough breakdown in terms of the level of intensive care, in terms of where kids are falling into each category? Do more kids require more intensive services or less intensive services, or somewhere in the middle?
So traditionally, we like to see like an 80-15-5 percentage. That's kind of like where we want it to be. Our prevalence data indicates that anywhere between 7 and 10% of youth may have a serious emotional disturbance. And so we're working really hard with our those are the numbers that kind of drive how we think about our resources. And so we recognize that once we are able to fully provide those services, we'll be able to match more of that. But right now, I think we are seeing more prevalence data. And we're hoping that once we can get these services in, it'll come down to that like 5% of kids with serious mental illness, 15% of kids who may be struggling with a mental illness but still need support.
And I think, looks like we're going to get there on the school piece later on today, but for anybody who hasn't read it, and anybody, watching at home, I'd encourage everyone to read the letter several years ago from local superintendents. I think they referred to our system as, I believe they described it as historic and unprecedented support for children's mental health in our schools. So that's a testament to the work that you're doing, so I appreciate it.
It's a testament to the county executive and his dedication to ensuring that all kids have access to mental health. He's a tremendous champion. Should we turn the page? Okay. Okay, so I did this also for adult mental health, and I felt like you guys appreciated this, so I wanted to do this for children's mental health as well. So I wanted to just kind of give you a one-page at a glance. This by no means represents the entire system. It is a highly complex system, which is why our access team is so essential for kids and families, because navigating all of this is really challenging, and we should, as a system, not expect families to have to navigate this on their own. And we don't. So you'll see there's, we have a crisis and immediate help level. We've got our community-based services and treatment level, our peer support and recovery, our our residential services, and our inpatient care. We also have a whole other page in prevention. And so I'll save that for our school-based work because that's where a great deal of our prevention is focused right now. So, what's been really fantastic is the development of our crisis system has heavily benefited both the kids and the adult systems together. You'll see a plethora of services in those community-based services and supports, and they're really aimed at supporting kids and families in their home, coming up with individual plans that address families' needs. A couple of really exciting ones that we use very, very regularly, like home-based crisis intervention. This is used if a youth may be experiencing challenges to a point where maybe they need a hospitalization, and we're all trying, family, youth, everyone's trying to avoid that. So the home-based crisis intervention team will go in, they'll work with families on safety planning, they'll do some family therapeutic intervention, they'll help the youth, they'll do some individual therapy with the youth, and they'll be there for 6 to 8 weeks and work to support creating stabilization and then move on to maybe an outpatient clinic, something along those lines. And so you'll see, as you're looking at these community-based services, they support kids at various different levels of need and intervention, and are really highly effective. If you match the need with the intervention, oftentimes we see incredible results with our kids and families. We're really excited to be offering peer support. So we have a youth peer support in our Healthy Transitions program. This is a grant we have from the federal government, from the SAMHSA administration, and it focuses on supporting youth who are transitioning from the children's mental health system to the adult mental health system, which can be very, very challenging. And having a youth peer in that environment has been really incredible. Peers in general are a major component of moving plans and systems forward. And oftentimes we find that peers can have an impact on families that professionals can't touch, right? Because they're individuals who've been through the system or been through the experience and can engage and support a family in a way that sometimes professionals just aren't able to do because they may not have lived the situation.
With,
Go ahead.
with
Yes.
that, can you touch on Hutchings a little bit? Because I know that there was like construction there and the state owns. I don't know
Sure.
how that's
So
built out.
at this moment in time, the only children's service that there's 2 children's services that Hutchings provides. There's an outpatient clinic, and then there's also the respite. They have a crisis respite. As you may know, the inpatient unit was recently, I think in the last 18 months, maybe 2 years, taken over by Upstate Medical University. And so the children's pavilion is still on the Hutchings campus, but Upstate owns it, or Upstate runs it. I'm not exactly sure where the construction process is ending with Hutchings. I know it's ongoing, and we're excited about that because it's supporting updating inpatient units for adults right now, and we're really excited about that. It also helped to move the children's outpatient clinic away from the adult outpatient clinic, so that's been really helpful to separate those two to create, a more youth-friendly environment for kids. It's been great.
So, kind of to summarize what you were saying so that I can get it in my head, they moved children's inpatient, then they have adult inpatient on one side, and then there's the outpatient pieces over there. And are all of those spaces being used over there, besides obviously what's under construction? But
I can't speak to all the spaces currently being used. I know that they've been trying to maximize the spaces as much as they can, and I know that they've worked heavily with Upstate Upstate's psychiatric department is over on the Hutchings campus as well, and they have a couple of different buildings there. So I think the state's been working really hard to maximize the property, and we're really excited about what's offered there now.
yeah, do we have any?
We do not.
We don't.
have any
We're not
space
involved in
there.
that, right? It's just
No.
we can refer people there and send them
Yes.
there. So you know that,
Yes.
so. Okay.
It's a
Great.
good question, though. We get it a lot. Like, do you
Yeah.
oversee Hutchings? No, we
Yeah,
don't.
yeah.
We do, from a county perspective, have that oversight role for all licensed programming where we support the state in ensuring that services are being met to the specific standard. But we don't have a further involvement than that.
Okay, thank you.
The one additional piece I just wanted to mention on the inpatient side is Upstate's new biobehavioral health unit, which has been a really exciting development in that it supports youth with developmental challenges and can also support youth with mental health and developmental challenges. That particular population right now, in this 6 months, is a major focus for the work that we're doing across our system of care. Youth that have mental health and developmental challenges are often caught between two different systems, and we're working really hard to create knowledge base across both different systems to be able to meet the needs of those individuals regardless of what kind of system they come into. It's kind of our next de-siloing effort that we're working on. But the biobehavioral health unit, and then there's an outpatient unit with that as well, has been highly effective and supportive in our community.
Thank you. Thank you.
Yes. So that's a general synopsis of the children's mental health piece. This last page is just drawing your attention back to the work of the local services plan. So the county we're excited to put together a 5-year strategic plan that works to ensure that we're focusing on all 3 disability populations: mental health, substance use, and developmental challenges. These strategies are presented to and delivered to OMH, OPWDD, OASAS, and they use them as well in their planning. So every county puts this plan together and moves it forward. We've structured it within our public health triangle. You'll see our 4 goals are prevention, access to services and support, which is that second tier, and then focus on high need population, as well as that data-driven and accountability piece. So that's kind of an opening with our children's mental health system. If you're ready, I'm ready to move on to school-based initiatives,
Anybody?
or if there's questions.
Good. We have Legislator Meeker. Looks like he has a question. Do you have a microphone over there?
I do.
Okay.
Is it working?
Yeah.
Perfect. Thank you. I'd like to start out by saying thank you for all you guys do. And there's some wonderful things happening with mental health throughout the county. And I would also like to give credit to the county executive for implementing this program. As a legislator, I see it work. And I talk to my constituents and they're telling me that it's working. However, they're also coming to me with some things that maybe we could put on the radar.
Mm-hmm.
So I can also speak not only as a legislator, but I can speak as a dad at this time. My daughter attends Baldwinsville High School and has utilized this service. The issue was, though, it took her almost 2 school years to get in. And I look at it from this perspective of identifying, and I'm sure that you're going to have a much more guided insight than I have. But from the outside, it seems that there's 2 issues. One, we need more funding. Mm-hmm. There needs to be more funding put towards these school programs. And 2, and I don't know how we as a county can fix it, but just to put it out there, there's not enough counselors. There's only 1 per school, mm-hmm. and with only having 1 per school, it's just not enough. Mm-hmm. So I just want to put those 2 things on the radar and see collaboratively how we can all, between you, this committee, the entire county ledge, how can we come up with ideas to solve those 2 issues to help more children? Mm-hmm. So
Thank you. I'm so glad that your daughter is benefiting. That's really exciting. And I am sorry it took 2 years. One of the challenges that we have faced, and it's very disappointing for families, for schools, and for the providers, is we're excited, we get into a building, and the individual that's working there, decides to make a different either career choice or, work at a different location. And so that has been, challenging. It's also been challenging because for those where we've been able to maintain those clinicians throughout the whole time. You're right that, they're working to build up their caseload as much as they can. And I think the schools and the clinics all agree that they would like to increase staffing within those spaces. But because of the workforce shortage, that's kind of created this, the slimming effect, I guess, for lack of a better term. I do know that in the last 4 or 5 months, we've been fully staffed across those buildings for the most part. Maybe 3 or 4, buildings are not covered across like our 86 buildings. But that is a major challenge. I think we're coming out of it. I'm hopeful that we're in a good place with that, but that is a major concern.
And I would think this is another situation where it's not as if, correct me if I'm wrong, the money is the issue. I think if we had a line of people that were willing, ready, and able to do the work, speaking for myself, I imagine most of the people at this table would be happy to support that. The issue has just been finding the people, right?
That has definitely been the issue.
If I can speak for a moment on this, I'm a licensed mental health counselor, so I've experienced a lot of this. I think a good part of it is retaining those people. So from what I know, because I've worked in places where they provide the therapists for school-based. They're young therapists, right? And so you get your license, and then what's more able to happen now, especially, is you move on. You go and you're out on your own. You hang your own shingle, right? And so when you come in, you get this caseload that is wild. I mean, 85 people is a huge caseload. And so to incentivize people staying, and yes, bringing in more than one at a school would be great, right? That break that caseload up. But that's just, I mean, that's no reflection here. It's all over.
Yes.
But I mean, that is a strategy that all over needs to come up with.
It is absolutely an issue, and we've worked really hard within our system to try and figure out how, as a county, would it be appropriate for us to support retention. And what we came up with was providing dollars for the clinics to train evidence-based practices. So, recognizing that as a clinician, if you're out on your own, you have to find your own evidence-based practice. But something that is part of the system of care is building in evidence-based practices. And so if we can specifically target, clinicians in outpatient treatment and specifically clinicians in school-based, hopefully that will help retain. And I do think that it did retain, and I think that it, helps because we have, more practitioners with further evidence-based practices. But as you say, it's an issue that's happening beyond our control to a great degree. So we're trying, and I know the clinic, we have regular conversations with, we bring all the mental health clinics that are in schools together on a regular basis, and we talk about this a lot. Okay, what are we doing? Who's got some good ideas? Who's implementing what? How can we, learn from each other?
Legislator Block, is there a continuing education component? And there's so many different practitioners that it's hard to know who falls in what categories, but somebody like yourself, are you required to do, credits every so often and things like that?
Yes, after your first licensure round, you have to get, I think it's 30 credit hours for your second renewal.
I think that would be a great opportunity to support not only providers who could save a few bucks on their education, but that way we know that we're bringing the best of the best of the research to our team throughout the community. So that's something to consider going forward.
Yeah, to piggyback on that, if you don't mind, you good? Okay. To piggyback on that, it's my understanding that we contract all of the provider work out, is that correct?
That we contract with all of them?
No. We contract out we don't have anybody that works for us and provides any of
Correct.
this. Okay, yeah. Do we look at what compensations or what incentives they're providing for providers, or do we look at different entities' ability for retention? So as, are there certain contractors, I'll call them, that are, cycling through people within the schools or within these, do we look at that across
So that's part of the conversation that we have on a regular basis with our clinics, and OMH supports us in that too. That's a lot of the foundational work that we do to, kind of look at how viable the program is, those kinds of things. So yes, that's a conversation that's happening on a regular basis.
Okay. Did you have something else, Legislator Maker? Legislator Maker?
Thank you, Legislator Romeo. Once again, you slowed my thunder a little bit there, but great minds do think alike. So, typically, it's run. Liberty Resources is the main company that brings in the counselors. Correct?
In Baldwinsville, yes, we also partner with Helio and Upstate Medical University, and Helio and Liberty have, Liberty has more, but Helio is a huge player as well.
Okay, so they're the ones that set rate of pay. They're the ones that set set the assignments of where their counselors go. It's the county doesn't really have a say in that piece, correct?
They make the ultimate decision. We are in constant communication and supporting fits within buildings and supporting, effectiveness. So
So there's a seat at the table, right?
yes,
You guys have a seat at the table to
yes, for
so
sure.
a thought I would have, again, don't even know if this is possible or not, but to increase kind of like how teachers use student teachers is would there be a way to segue students at the college level who are going to school for counselors, and during the school year to bring them in to help, kind of like a clinical type deal?
Yes, that's an excellent thought process. The clinics now try to maximize students as much as possible, and we've worked at the state level to support ensuring that regulations allow for that. And we're also at the county level, we're also working, we have a director of professional development initiatives, and she's right now working with colleges and with high schools to try and bring more youth, now they're older students, sorry, to bring students into the system. And so, this week she's working with the providers and the schools to connect them to bring students into the environment and seeing how we can maximize them. So that's a fantastic idea, and I think one that we're digging into.
Thank you very much.
Thank you.
Is everyone good for them to move on? Good. Thank you.
Okay. So this our school-based initiatives, again, we are known across the state for having landmark work. And to be honest, once Onondaga started this work, many counties started to move in this direction. And so we've really led the way. And really, really excited about it. So the first page is just kind of generally speaking, overall, the county, the work that we do brings in about $23 million in supports and services across all of our school districts. It is a major factor in support for kids and families. School districts are matching at least $7 million of that. They're matching more, but these are kind of like direct to direct contracts that they're matching. The next page kind of talks a little bit about our multi-tiered system of support. So again, this is that public health triangle, and recognizing that if we're going to try and support 90,000 youth, because that's how many school-aged youth we have in Onondaga County, we needed to figure out a way to do this that would be most effective. And the public health triangle helps us do that. The schools have adopted the public health triangle through what they call the multi-tiered system of support. So they're looking at, again, what you're doing for all kids, and that should benefit at least 80%. What you're doing for kids that have some additional need, that should benefit at least 15%. And then what are you doing for kids with the highest level of need? We're also incorporating the system of care construct into this, right? And so really thinking about how our network of supports across the county in a de-siloed way, right? Doesn't matter if you're coming in from child welfare, juvenile justice, mental health, your needs are your needs. We're going to help you get access to those needs. So putting those two things together is what is so exciting about the work that Onondaga County is doing, and so groundbreaking. So we have pages and pages that we're going to go through that show you the different investments we're making at the different levels to ensure that we're addressing the needs of all kids. It is fabulous. It is groundbreaking, and there's still more work to be done, as always, right? So that first piece is looking at our school-based outpatient mental health clinics. We were just talking about them. In the school year of 24-25, we served about 2,500 youth across the county. That generated about $8 million in third-party billing, so insurance billing, those kinds of things. And we have 86 schools that have been that have a clinician that's co-located in the school. Co-location is essential, right? Because it allows for families to not have to, transport their youth. Oftentimes families give up full days or full half days to get their youth to an appointment. This allows for quick and easy. This also allows for tremendous multidisciplinary approaches and ensuring that the plans bring every person to the table. So you'll see our student count has grown and grown and grown. This is something that the county executive has been a tremendous support, really, pushing us to make sure that we're getting this across the entire district, or I'm sorry, across the entire county. And the partners, Helio, Liberty, and Upstate, have been tremendous in this work. They have really helped us push this forward.
I have a question about that $8 million that gets reimbursed.
Yep.
Where does that go?
So those are insurance billings that come into the outpatient clinic, and so
Yeah.
it pays for the clinicians. It allows for the clinicians to be sustaining, and the county, does not need to put additional dollars into that, which is one of the really exciting pieces associated with this work, is that we can create sustainability through existing
So
resources.
it'll all come back to the county.
No, the dollars.
Come back to the county. Whose first dollar spent, I guess, is kind of where I'm going with it, because of this 23 million, most of it comes from the state or federal government, and then the school district is matching, and then we are putting some. So
the way that it's structured is the county invests in startup dollars to support schools in partnering with a clinician or with a clinic. And then the other investment occurs really at an administrative level. So we're working with the districts, we're working with the clinics, we're making sure that everybody understands the regulations and that there's a quality of care and there's a standard of care, and that's been just phenomenal to work with them on. The whole model is that they're self-sustaining, and so those insurances are self-sustaining, so sustain the model. So the county does not need to put additional dollars in. Those insurances, they could be commercial insurances, they could be Medicaid, they could be Medicaid fee-for-service, they could be Medicaid commercial insurance, that kind of stuff.
okay,
Managed care, I meant, sorry.
I understand, but yeah.
Specific to the clinics.
Is that correct? John's talking about the mental health clinics, and I think Legislator Romeo, you're talking about the full investment. The 22 million full investment.
Yeah, just all of it. Just is that
He
included? I
wants to
assume
know
that's
about the
included in it?
local piece.
I see. So would you mind asking your question one more time? I just
Yeah, no. Tell me if you need to push my question in a direction that makes sense. We have on this page about the 23 million that comes from the federal, state, and the county that goes into making sure these systems are provided. The 7 million is the school district, and then there's $8 million provided. But based on what I just heard from you, the county portion of that is to build out the program, and then the program itself is self-sustaining. So is it reimbursement payment coming from above?
It's reimbursement coming from commercial insurances. The 23 million is absolutely made up of a great deal of our state aid, a great deal of our local dollars. We work really hard to blend as much as we can. So we pull from some child welfare prevention dollars. We pull from some federal grants. We pull from some OMH grants. And as part of that $23 million, this $8 million is in that dollar, representing that we're pulling this revenue into the county. Is that answering the question?
Yeah.
Not the county government.
Not Onondaga County into our economic.
Yeah. So that 8 million isn't going to anybody. It's just paying for that.
Correct.
And no matter how much comes in from that, how much is invested will not change. Is that accurate? Is it on top of, right? Is this in addition, or is this covering some of those?
The 8 million goes specific to the mental health clinics.
Yeah. Go on. It sounds like. Yeah. So when we say state, local dollars, and school districts $30 million, we're going to put $30 million into this program. We all pitch in our $30 million. It gets the program running. Then the $8 million comes in. And that then it's the $30 million that all of us provided plus the $8 million that was provided.
The 8 million is included in the 30.
It's included in the 30.
Yes.
Got it. Okay.
Awesome.
So when we look at like the school-based initiatives line, it says like there's 14.9 million for this year, whatever it is.
May I interrupt for a second?
Yeah.
You've heard of the concept of braided funding. We have braided more funding in this school-based mental health system than you could ever imagine to make all of the parts of the triangle work.
Yeah.
So the clinics are at the top of that triangle, but the full $30 million investment includes across the whole schools, you know, for the lowest level kids who need assistance, those middle kids, and then the highest level. And so that investment, you know, we get a 1.2 member item every year from Assemblyman Magnarelli. That's included. The local investment is included. As Jen referenced, we pull down child welfare dollars. We use preventive dollars. Obviously, we use mental health dollars. We use OASIS dollars. This braided funding across all of these platforms creates this wide-ranging school-based mental health initiative that allows us to do it across the whole county. So, but the 8 million you're specifically referring to, that is billed to insurance companies of children who are receiving those clinic services. So that goes to reimburse Helio and Liberty for their clinician services. But it is part of the 30 million that makes up the whole system.
I think I understand it now. Thank you. Sorry, it took us a little bit to get there. Oh, can you state your name and position, please?
Sure. Ann Rooney, Deputy County Executive here in Onondaga County for Human Services.
Thank you. I know we've met, but there are some people out there that you haven't met.
So in terms of ongoing investments then, with this sustainability model, what is our role going forward? Is it simply well, not simply, because this is a lot built into this, but there's obviously the contract component with these agencies. What are the recurring costs, and what does it take to sustain this going forward from local dollar perspective?
I'm wondering if I could walk through a little bit more about what we
Please.
provide, and then maybe give you that
Sure.
sense. I think that might help
Yeah.
a little bit. So we talked a little bit about our access team. I tried on each of these programs that we're investing in to share what the dollar investment is, so you can kind of get a sense of like where that falls. I talked earlier about the access team, connecting with all of the schools. We served 4,100 youth during the school year of 2024-25. We're in 121 schools. It's all of the schools across our district. And there was a $3 million investment to ensure that happens. There are probably 8 to 10 different funding streams going into this $3 million. And that's where Ann's talking about us maximizing our finances and braiding the funding to ensure that we're meeting the need.
And some of the funding sources, particularly through the State Office of Mental Health, they have annual COLAs that are added to
Good.
the funds.
we also have some local dollars as well invested here. We're excited about, I think that we've talked about the OTDA anti-poverty award to Onondaga County, and as one of the 4 projects, we put together a special attendance project with the Access team to support kids who may have chronic absenteeism, so kids who are experiencing 10% or more absenteeism challenges and are also receiving TANF services. And so we started this in the 2024-25 school year in April. This year, we'll see much more robust numbers, but we just started it in April of this school year, of last school year. So at the time, we had 4 liaisons, we served 190 youth, and we had 4 schools, and we had 6 staff assigned. We now have 7 staff assigned, and I think we're up to 15 schools. And we're serving more than 400 youth at the moment. So really exciting, relentless pursuit of engagement, going to families' homes immediately, supporting them with what might be getting in the way of getting the youth to school, and we've seen tremendous gains. The Promise Zone student engagement specialists. So this particular approach really supports us at like the universal level and the tier 2 level. So we work to have a Promise Zone student engagement specialist in each building, 1 per building, and the goal is to provide social emotional support, whether it be from a prevention place, whether it be from a intervening during a crisis place. They widely support the social workers and the psychologists in understanding what kids might be struggling and putting interventions in place. So there were 9,500 youth that were explicitly supported during last school year with interventions. We had 200,000 interventions occur across those 9,000 youth. We have 71 staff, which we're really excited about, and the total investment here is about $6.5 million. Again, braided funding. This is a really exciting partnership where we have some of Magnarelli's grant, we have local dollars, and then the school districts invest about 54% in each of the positions as well. So it's a really phenomenal partnership with our districts.
We loved this program when I was on the board.
Awesome. We do too. Wanted to talk a little bit about school-based threat assessment. We have been working, this is a county executive initiative that we're just so excited about. I'm sorry, Fitzpatrick, the DA, our DA Fitzpatrick, I'm so sorry. Wanted to make sure that we were protecting our youth across the community and doing so in a way that was addressing needs of the youth that may be struggling and may actually come up at risk at this point. So we trained about 600 staff so far across Onondaga County in the Salem-Kaiser Cascade model. We've established structures so that we are all using the same language, we're all using the same assessment, and we've created a level 2 threat assessment team, which is like a county level team. So the school will do an assessment. If they're concerned that they aren't able to manage the situation, they'll bring that to our level 2 team, which includes sheriff's office, my office, Amy and her team with child welfare and juvenile justice, the DA's office, a multidisciplinary and mental health providers, multidisciplinary team to help support kids. It's been tremendously effective. We've seen some kids who are really hurting that have been able to be intervened with and we're in a much safer place with those youth at this time. So this is another one of those identification portals, to be honest, where, people thought everything was kind of going okay and then something would occur. And we are noticing that a number of these kids were just off everyone's radar because they were quiet and okay. And so we're really excited about this new system because we're identifying and intervening with kids who may really be struggling. So then our family support for student success model. So this is a really exciting model that our child welfare team has worked tirelessly to train. Where are we at? We're at now 52 staff to work across to work across Syracuse City School District, BOCES, and Solvay to support kids and families who may have child welfare related needs at a preventive level. So there's about 3.9 million that is invested in this program. This is again a partnership where we have school districts investing. So Syracuse City School Districts invest about 1.5 million in the program each year. Really excited about this work. We have 398 families that were served last year with 137 new cases opened. We work with Primary Project, which is a evidence-based practice that supports youth who are transitioning into elementary school that may be struggling. And we have, done that work for many, many years in partnership with Contact Community Services. Right now, that work is happening within East Syracuse, Manoa, and also Syracuse City School District. So we've served about 77 youth who were struggling in their elementary transition, been really successful. Our PACS Good Behavior Game is also a partnership with Contact Community Services, and this is a universal intervention. So this is one where teachers are trained to play a game with kids in their classroom in a particular way that helps build up their social emotional supports and their social emotional skill set and make them highly resilient. It's one of the evidence-based practices within the ones that we can choose from that actually shows gains in elementary students, gains that go into high school and college for less suicidal ideation and less dabbling in substances. So it's a very, very powerful tool that we would love to support. Wherever we can, we're always selling districts on it. It's a great project.
I'd be curious to see the effect size on that one because a 95% success rate might be the single most effective intervention I've ever heard of.
It's really phenomenal, and the teachers, I think, love it. They support building this really beautiful culture in their classroom, but at the same time, a lot of it is, giving kids rewards for just kind of waiting and making sure you're raising your hand, and just kind of that baseline social emotional soft skills that we want all of our kids to benefit from.
Yeah, with that, Legislator Cody, when we did a review of that program when I was on the board, the amount of teachers that were actually using like the language and how they were supposed to use it was same thing. It was like high 90%, where we were like, we can't get that many people to do anything. Yeah. But to that point, do we express our frustration with school districts that might pull away from this program?
We're always supporting perspectives on evidence-based practices and reminding where we as a county are investing. So we definitely support the PAC's work.
Understood.
And pushing at the state level too. We had the
Yes.
OSS commissioner visit a year or so ago, and kind of pushing across the board funding for it.
Thank you. Can you tap your mic to make sure it works?
Our student assistance counselors, we also partner with Contact, and these counselors are in Syracuse City, North Syracuse, and then also FM. This is a really exciting intervention. It creates an opportunity for counselors to be in buildings that function at a highly confidential level. So kids can go and get engage with the counselor, share concerns that they may be having, but it doesn't necessarily result in some sort of, bill to insurance or long-term treatment, but it can result in that they'll do an evaluation, they'll make referrals if need to, but they're able to really engage with kids and support kids in a way that sometimes the formalized system is just too much of a lift for kids and families, and this helps, them gain access. Also, our student assistance counselors provide lots of education and support around prevention activities within the buildings as well. So they served 532 students last year, and the investment is about $1 million. This is mostly OASAS funded, and then also the districts provide about 50% of the cost as well. So it's a great partnership as well. And then some of our other services, we have Seeds of Peace, Building Men, and the Peacemaking Project, all all investments in youth development type work. Seeds of Peace is really helping to build some of those social emotional skills and development of creating peer environments that are welcoming and supportive. Building Men has the after school program that's been working at the middle school and the high school levels, and is supporting young men, and again building a lot of those skills. And then our Peacemaking Project, I'm really excited about. This is kind of that if there's a challenge, bringing people together, having restorative conversations, and working through challenges together in a way that's evidence-based practice. And then our final program, I just wanted to make sure you guys were all aware of, we do have child care workers, Onondaga County staff that are child care workers working within the McCarthy at Beard School. So this is part of the partnership with Upstate and Syracuse City School District. We have 5 funded positions, and they are there to provide social emotional support, work with teams on what the plans are for kids, helping to carry through interventions with kids and families. And so really excited about that partnership as well, and really excited to see kind of where the McCarthy at Beard School has transitioned to with the partnership with Upstate. We've seen really tremendous gains.
Any questions from, yep.
Hello. Okay. Thank you so much. I just had 2 questions. I was wondering what happens in the summertime for the kids for the mental health, and then also I don't know if you there's different programs and different recommendations on different programs. There's been a lot of research about school start times for older kids, and I was wondering, with you having so much access to schools across the county, has there been any discussion about that really important issue?
So in relation to the school times, we work really hard to separate out our responsibilities and what we can support. And so from an academic perspective, we trust and value schools to kind of manage that piece. We talk about social emotional supports regularly, and we're happy to, engage in that conversation. We have not had a lot of conversation about start times at this point. We do have a steering committee that meets on a monthly basis that, representatives from all the districts can be part of that conversation. And we let them choose where they want to prioritize their conversations, and start times has not come up as one of those conversations.
'Cause I know it's really important for mental health, so that's why I
Sure.
bring it up.
Absolutely. Yep. I appreciate that.
Physical health too.
Yes. In terms of summer, many of the programs try to figure out how to remain engaged with youth during the summer. Specifically, the outpatient clinics are still required to participate with and support youth during the summer. They don't, they're not considered closed. So many of the districts run summer school, and so we work to try and have those clinicians be at those sites, or they'll maybe do a lot of home visits, that kind of thing. So they're still responsible for mental health treatment during that time. Our Promise Zone staff, for instance, oftentimes staff the summer school program, so we end up being a tremendous support during the summer for districts. Our FSSS program still works with kids and families during the summer. Whether school's in or out it doesn't impact the work they do. So we work really hard to make sure that most of these services are 12-month services.
Thank you.
Welcome.
Okay. Any other questions? Good. Legislature, are you good? All right. Well, thank you very much for coming and giving us all this information. Appreciate the work you do.
For the time.
Can I get a motion to close the meeting? Okay, second. All right. All in favor?
Aye.
All right. The meeting of Health and Human Services is closed at 2:12. Thank you, everyone.